Hi everyone, welcome back to Veronica and Shannon Know Everything. Today we're going to be going over benign prostatic hyperplasia,
You have to do the song.
BPH. So one thing with this is the most common benign tumor found in men. And so the first thing we're going to be going over is the Gleason score, 2 through 10. So this is a little song we came up with.
Gleason score is 2 through 10. Prostate cancer is only for men.
Okay, so remember that. So now going over the scoring system. So how it works is there are two different types of tissue that are looked at, and they're each given a score. So it's a matter of two numbers that are put together to create the score. So 2 to 4 is low risk, and then you have 5 to 6, which is medium risk, and then 7 is where things are kind of dependent. So if you have 3 to 4, then it's medium, and if you have 4 to 3, it's high risk. So just remember the higher number is high risk, so 43, and then high risk is 8 to 10. So again, Gleason score 2 through 10. Prostate cancer is only in men.
So
there you go. So now as far as treatment, so the first thing is going to be watchful waiting. So this is all very dependent again on the patient and the provider, and also on the score. So with watchful waiting, you typically always do that if you have a low risk patient, but it's also an option for a medium or a high risk patient. And again, that's going to be dependent on your patient and what the provider discuss together. The next thing are going to be meds. So these are going to be alpha blockers that you're going to be using. And then the other option would be surgery, so a TURP. So I just want to quickly go over the alpha blockers and the options. So you have old or non-selective, and then you also have new or uroselective. So with non-selective, you have doxazosin and terazosin. So just remember Doctotera, she's non-selective, so that'll help you remember. And all the alpha blockers, they end with zosin, so that's how you know they are an alpha blocker. And then as far as the new, you have tamalosin, which is Flomax. You have alphazosin and then silodosin. And so just a few things with this. The old, they cause orthostatic hypotension, so that's one thing to note. It can occur with the new, but if that's something that comes up, just kind of refer back to the old. Something with the new is it causes retrograde ejaculation, so that's where the individual's not ejaculating out, but it's going backwards into their body and their system. So that's BPH. Just remember, Gleason score 2 through 10, prostate cancer is only in men.